am so excited when I saw the buses coming in this morning. I saw the group. Oh, I was so, believe me, I was overjoyed.
Because if it wasn't for this team right now, we'd have a stroke.
AOJAH has been conducting free medical missions in Jamaica for over a decade. This year, our volunteer team consisted of individuals from various parts of the United States, England, and Jamaica. Our 66 volunteers included 13 physicians in various specialties, 18 support staff, 12 optometry students, 7 optometrists, 7 nurses, 3 pharmacists, and our board of directors. Our 5-day mission was based in the parishes of St. Anne and St. Mary, and the clinics were set up in mostly rural areas. Why do we do these missions? Well, the obvious answer is that we are giving back to those who are less fortunate than ourselves. But the better answer is that it humanizes us all, both the giver and the receiver. It creates an instant human bond of trust and goodwill that transcends geography and politics and reverberates in households and communities like ripples in a pond. It is life-changing services that could help improve the vision of a child so that they can read a book, or allow a parent to focus on other financial concerns rather than the cost of prescription medications. It is acknowledging the human in humanity. And after all, it is who we have decided to be. We are the Alliance of Jamaican and American Humanitarians. And this year, for the first time, we expanded our medical mission to the island of Grenada. At the hospital, the team performed cataract surgeries for those who were previously screened and qualified, and assessments for those who had appointments. Nevertheless, many people who did not have appointments sat and waited patiently outside under a tent for countless hours in the hopes that they would be seen. One patient, before entering the doors of the operating theater, stood and lifted her hands above her head and prayed out loud that she would make it out safely. It was not until 7:35 p.m. that all the chairs under the tent were vacant, and the team boarded the bus for the hour-and-a-half drive back to the hotel.
I come to do a surgery on my eye, and it was nice. Was no pain, and I really appreciate everyone's effort, and I thank everyone for doing this, and the doctors as well. I really appreciate it. Everyone was so friendly and nice. Meanwhile, going through the process, they make you smile, and I thank God for that.
Okay, I came here today to Port Maria Hospital to get my eyes tested, and I had a checkup by a doctor, and who very clear told me that I had maybe baby glaucoma, but I had no real problem, and so I've gone away very happy.
Hello, my name is Dr. Eric Email, and we're here right now in Jamaica, St. Anne's Bay. We're at Faith's Pen, and we're having a medical clinic from AOJAH, and we got here this morning, and we're going to be here until all the patients are seen. I'm a pediatrician. I believe this is my 7th or 8th trip, and the reason why I started coming because I was requested to come, and I felt there was a need to come to serve the people here who were in need of medical care in order to get well and healthy and to maintain their well-being. So that's why I'm here. My 7th or 8th year, I've been enjoying it so much, the beautiful country, the beautiful people of Jamaica and St. Anne's Bay. And after a few years, my wife Chiquita started coming with me, and she's been here a couple of years, and she's going to tell her story.
I think this is probably my 5th year, and we've also brought our son. He came a couple of years as well. Since I've been coming, I've worked with the educational team, I've worked with the dental team, and then the last three times I've come, I worked with my husband's team, and basically I work on registration. So my role is to help get people registered so that then they can get triaged by the nurses to see the physicians. And I come to serve, basically. You know, I love to give back. I love the people of Jamaica. I love Jamaica. And it just makes my heart glad to see people get care that otherwise would not receive care. So we're just happy to serve.
Yes. And so in the back of us, we have our clinic. I am a doctor of pediatric medicine, and so I'm helping to take care of some of the younger adults and the children. And so we're taking care of everybody who comes in, who has a request, who has a need. We also have an eye team who is taking care of people who may have a glaucoma or some other eye problems. And we're just out here, just meeting the need, enjoying the people, and serving. And it's been great so far.
My name is Janice Nelson. I am the principal of Village Primary and Infant School. I started working at Village Primary and Infant School in 2017, January. When I started at Village, there were only 47 children in the institution. To date, we have 128 students so far. Now the program we have at our school today, the health fair, I am so elated to have the team here. It's been from 2017 that I've always wanted to have a health fair. I'm so excited when I saw the buses coming in this morning. I saw the group. Oh, I was so, believe me, I was overjoyed. But I am happy to have them. I know the community is happy to have them. It's been a while that they haven't had a health fair this close. I'm happy because they have taken out those who are bedridden. Even the bedridden ones, we ensure that we spread the word to get them out of the community, and they are here with us today. So I just want to say thanks very much to the group, thanks to the team of doctors who take the opportunity to be here with us. And you know what is best, that makes me happy? They don't have to pay $1. It's all free service. So I know they will embrace it, and I must say I look forward to seeing you another year.
Hello, I'm Dr. Roberta Duce, and I am here in Jamaica to help because we care, and I'm on this mission. And I've been on missions before. The previous missions were in Sierra Leone in Africa, and I came here. A friend of mine told me about it and told me about the cause, so I came here for that reason, to help people. And people here are so grateful, and they are so happy. I've seen a lot of different things here. Patients that need many patients that need more medications, patients that need treatment for their high blood pressure out of control. We treat them, the nurses follow up with them. I've seen patients that needed help because they had surgeries and had infection afterwards. We took care of their wound dressings, we gave them antibiotics. It has been very rewarding to help here, and people are really grateful.
My name is Trishelle Jackson, and this is my cousin Chardane Douglas. We are at the Village Primary and Infant School in Faithspen. She came and she got a medical check, and she also got her eye test. Based on the evaluation done, she got some vitamin, as well as she also received an eyeglass from the optician. I am grateful for the service that she has received, and I wish that we could get it next year as well. And thank you very much for coming.
My name is Derek Graham, and today I am here at the Village Primary and Infant School. And the service here today, we have the doctors, we have the part personnel and various other type of service, and I'm here today just to see the doctor. Service so far today, there has been excellent. It's real good.
My name is Elizabeth Oyekon. I am a pharmacist, and I have been with AOJAH since actually 2002, when it was under another organization called JAAC. I have been coming on and off for the last 16 years, and I first started coming out of respect for my boss, Joan. She was my boss when I started coming, and But what has actually kept me at the people? There's such gratitude for what we do, for the little things that we do, and for the big things that we do. One of the things that we have found out in Jamaica that even if they can get medical care, a lot of times they cannot afford the prescriptions. And so when we come and we not only bring prescriptions, but then we give them anywhere from 6 months to a year's supply, imagine what that means to them. That means that they now, instead of thinking about, do I spend my money on my rent or on my medicines, they can now safely spend their money on their rent, taking care of other things in their lives. And so being able to come to these communities, share our knowledge with them, provide for their medication and medical needs has been such a blessing and is what keeps me coming. The other thing also is right now, for example, today we're taking care of what we call the working poor. So they work at the hotel, but they don't necessarily have the funding to take care of these medications. So we just dispensed a year's worth of medication to one of the patients. And all she said to me, she says, God bless you, God bless you, God bless you. Because now she can think about using her money for other things. So when you talk to patients like that and when they show that type of appreciation, it is something that keeps us coming. The last thing I would just like to say is for each and every one, not everybody can come, but one thing everybody can do is to donate. And so our hope and our goal is that while you may not come, be able to join us, we hope that you will consider becoming a lifelong member, a contributing member for AOJAH, and your dollars will go so far. Thank you all so much.
Good morning, everyone. My name's Adetoyin Oyekon, daughter of Elizabeth Oyekon, and I am one of the medical doctors, part of AOJAH. I have been coming since I was 12 years old. My mom brought me on these medical mission trips, trying to, I think, introduce me to the world of medicine and also to teach me how to be a bit more grateful for life back in the States. And these trips really inspired me when I was younger to end up becoming a medical doctor. And last year was the first time I got to come back as a fully fledged doctor and start serving the community beyond the role of admin assistant and actually as a medical professional. And I just absolutely love coming here. People are so grateful for what we do. Even when we can't do everything, they're just still grateful for this bit that we can do. And seeing that it's just so beautiful. And especially the children. Oh, I just absolutely love working with the children. They just are such beacons of light and just fun, and I'm just really, really happy when we can help them out, help their parents out as well, to be able to provide both the children and their parents with some medication so that the parents have a bit more money and time to spend with their children as well, and also educating as well. It's been really, really good, like being able to see some of those light bulbs going off when you speak to patients about their condition and sort of why they're having it and what they can do about it. Trying to just empower them to be able to take care of their own health as well is also really beautiful. So that's why I keep coming back. I've been doing this 5 years on and off, yes, since I was 12, which would have been back in like 2008 or something like that. And that's why I'll keep on coming back. And yes, I hope that we can see some more people that love doing this type of stuff as well, coming in the next following years.
So I'm Roseanne Virgo, and I'm currently the acting parish manager for the Trelawney Parish Office of the Heart NSTA Trust. What we do at Heart, we are about human capital development, where we do training, assessment, certification, job placement, and career advisement services. Now we have a partnership with the Alliance of Jamaica and American Humanitarians, AOJAH, where we work with them to find the basic schools that are in need in the parish of St. Anne. We will assist by providing the transportation component to take the respective mission officers across to the different schools. We also have the scholarship program where they provide scholarships for well-needed persons from the Hart College of Hospitality Services. So we'll shortlist a set of persons and the interviews are conducted for the scholarships to be granted to these persons. This is done on an annual basis. We want to take the time out to thank AOJAH for what they have been doing over the years, because we look forward to continued partnership with AOJAH as we help to transform Jamaica.
I want to thank everyone for this hard program, and I want to say thanks for the visitor here come a long way just for us and our school and our community and our country. And I want to say thank you for everyone in the art to support us in the art program.
With us today, we have our visitors who are the people today, because they're the group from the Alliance of Jamaican and American Humanitarians, and they do an annual scholarship for students at the Hart College of Hospitality Services.
This is an organization that's currently based in California. We started about 11 or so years ago, and our main purpose is to help people in need. So we have fundraisers and we raise funds where we're able to help people in Los Angeles as well as Jamaica. And
we've heard your stories. Stories were so touching. So we decided to up it to 8 scholarships. Alicia Robinson. Ronaldino Lee. Alex Erskine. Ashanti Ali. And Renee Nation.
On the last evening of the mission, we gathered to celebrate the success of the mission. And then it was time to relax and have some fun after 5 straight days of 10 to 12-hour work days, helping to provide life-changing services to those in need.